Did you know that something as simple as a urinary tract infection could trigger a stroke? Or that the glass of water you didn't drink this morning might have put you at risk? What I'm about to share with you could literally save your life or the life of someone you love. These aren't the typical stroke risk factors your doctor talks about. These are the hidden triggers that can cause a stroke seemingly out of nowhere, and most people have no idea they exist. Every 40 seconds, someone in the United States has a stroke. That's more than 795,000 people every year. But here's what's truly shocking: many of these strokes are triggered by factors that seem completely unrelated to brain health. The American Heart Association recently updated their stroke prevention guidelines in 2024, and the research has uncovered some surprising connections that even many healthcare professionals don't fully understand. I'm going to walk you through 10 hidden stroke triggers that have been validated by peer-reviewed research from institutions like Harvard Medical School, the Centers for Disease Control, and the National Institutes of Health. By the end of this video, you'll know exactly what to watch for and how to protect yourself and your family. Let's start with something that might surprise you: infections. Not just any infections, but specifically urinary tract infections. Harvard Health Publishing has highlighted research showing that infections, particularly those affecting the urinary tract, may significantly raise your stroke risk. Here's why this matters. When your body fights an infection, it creates inflammation throughout your entire system. This inflammation doesn't just stay localized to where the infection is happening, it travels through your bloodstream. The inflammation from a UTI causes your blood to become stickier and more prone to clotting. Most strokes, about 87% according to the CDC, are ischemic strokes, which means they're caused by blood clots that block blood flow to your brain. When you have that underlying inflammation from something as common as a UTI, you're creating the perfect storm for clot formation. The Cardiovascular Health Study, which followed nearly 6,000 participants, found that recent hospitalization for any infection was associated with increased stroke risk in what researchers call a case crossover analysis. But UTIs aren't the only infections that can trigger strokes. Respiratory infections, dental infections, and even sepsis can all create this same inflammatory response. Think about the last time you had a bad cold or the flu. Your whole body felt inflamed, right? That systemic inflammation is affecting your cardiovascular system in ways you probably never considered. The research published in Circulation Research specifically identifies infectious events as short-term stroke triggers, meaning they can precipitate a stroke relatively quickly after the infection begins. Now let's talk about something even more common: dehydration. This might be the most underestimated stroke trigger on our entire list. Research shows that nearly half of all stroke patients arrive at the hospital already dehydrated. Think about that for a moment. Half of all stroke victims were dehydrated when their stroke occurred. This isn't a coincidence. When you're dehydrated, your blood becomes thicker and more concentrated. It's like the difference between trying to drink water through a straw versus trying to drink honey through that same straw. Your heart has to work harder to pump this thicker blood through your vessels, and the risk of clot formation increases dramatically. UT Southwestern Medical Center explains that these fluid imbalances can lead to stroke if certain areas of the brain don't receive adequate blood flow. What makes dehydration particularly dangerous as a stroke trigger is how easily it can happen without you realizing it. You don't have to be exercising in extreme heat or obviously sweating buckets. Mild chronic dehydration, the kind that happens when you're drinking more coffee than water, when you're busy and forget to hydrate, or when you're taking medications that have diuretic effects, can gradually increase your stroke risk. The research shows that up to 2/3 of stroke patients experience worsening dehydration during their hospital stay, which negatively affects their ability to recover. Our third hidden trigger is something that affects millions of people every single night: sleep disorders, particularly sleep apnea. The connection between sleep problems and stroke risk is more direct than most people realize. When you have sleep apnea, you're repeatedly stopping breathing throughout the night, Each time this happens, your oxygen levels drop and your blood pressure spikes as your body struggles to restart breathing. This creates what researchers call intermittent hypoxia, repeated episodes of low oxygen. Your cardiovascular system is essentially being stressed over and over again, night after night, year after year. The American Stroke Association recognizes sleep apnea as a significant risk factor, but what many people don't understand is that it can act as an immediate trigger, not just a long-term risk factor. Poor sleep quality has been identified as one of the triggers for atrial fibrillation, according to research from the University of Michigan, and atrial fibrillation dramatically increases stroke risk by causing irregular heartbeats that can lead to clot formation. But it's not just sleep apnea. Chronic sleep deprivation, insomnia, and irregular sleep patterns all contribute to stroke risk through multiple mechanisms. Sleep is when your body repairs itself, including your blood vessels. When you consistently get poor quality sleep, you're essentially depriving your cardiovascular system of its daily maintenance time. Your blood pressure doesn't get the normal dip it should during sleep. Inflammatory markers remain elevated, and your blood sugar regulation gets disrupted. Let's move on to trigger number 4, extreme emotional stress or trauma. The research on stress-induced strokes is both fascinating and alarming. When you experience severe emotional stress, whether it's the death of a loved one, a divorce, job loss, or any other major life trauma, your body releases a flood of stress hormones, including cortisol and adrenaline. These hormones cause immediate changes in your cardiovascular system. Your heart rate spikes, your blood pressure shoots up, and your blood becomes more prone to clotting. This is why we sometimes hear about people having strokes immediately after receiving devastating news or during extremely stressful situations. It's not just a figure of speech when someone says something was so stressful it nearly gave them a stroke. The physiological reality is that severe acute stress can literally trigger one. The research from the American Heart Association identifies acute stress as a short-term trigger for stroke. What's particularly important to understand is that this isn't just about chronic stress, although that's certainly a risk factor too. We're talking about acute, severe stress that creates an immediate physiological crisis in your body. Think about how your body feels when you're in a state of panic or extreme distress. Your heart pounds, you might feel short of breath, you get sweaty. All of these physical responses indicate that your cardiovascular system is under intense strain. Our fifth hidden trigger might shock you: extreme weather changes, particularly sudden drops in temperature. The research shows that stroke rates increase during cold weather, and it's not just because people are more sedentary in winter. When you're exposed to sudden cold, your blood vessels constrict rapidly to preserve body heat. This vasoconstriction increases blood pressure and can trigger stroke in people who are already at risk. But it's not just the cold itself, it's the rapid change. Going from a warm indoor environment to bitter cold outdoors, or even taking a very cold shower, can create the kind of sudden vascular changes that precipitate a stroke. This is why you often hear about people having heart attacks or strokes while shoveling snow. It's not just the physical exertion, it's the combination of cold exposure, sudden physical activity, and the body's stress response to the temperature change. Atmospheric pressure changes can also affect stroke risk. Some research suggests that rapid changes in barometric pressure, the kind that happen before major weather fronts move through, can affect blood pressure and increase the likelihood of cardiovascular events. While this might sound far-fetched, remember that our bodies are finely tuned biological systems that respond to environmental changes in ways we're only beginning to understand. Let's talk about trigger number 6, certain medications and drug interactions. This is an area where many people unknowingly put themselves at risk. Some medications that are commonly prescribed for other conditions can increase stroke risk, particularly when combined with certain other drugs or supplements. Hormonal medications, including birth control pills and hormone replacement therapy, can increase clotting risk. The risk is generally low for healthy individuals, but it becomes more significant when combined with other factors like smoking, age over 35, or underlying clotting disorders. What many people don't realize is that even over-the-counter medications can contribute to stroke risk in certain circumstances. Non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen and naproxen, can increase stroke risk, particularly when used regularly over long periods. The FDA has issued warnings about this, noting that the risk may increase with higher doses and longer duration of use. The mechanism involves effects on blood pressure and kidney function, which can contribute to cardiovascular problems. Decongestants containing pseudoephedrine or phenylephrine can cause blood pressure spikes, particularly in people who already have hypertension. Even some herbal supplements can interact with prescription medications in ways that affect clotting or blood pressure. Street John's wort, for example, can affect how certain blood thinners work in your body. Trigger number 7 is something that many people do regularly without thinking twice about it: sudden, intense physical exertion. I'm not talking about regular exercise, which is actually protective against stroke. I'm talking about sudden, vigorous activity in people who are generally sedentary or who push themselves far beyond their normal activity level. The classic example is the weekend warrior syndrome, someone who sits at a desk all week and then tries to run a marathon or engage in high-intensity sports on the weekend. This sudden demand on a deconditioned cardiovascular system can trigger stroke through several mechanisms. The sudden increase in blood pressure, the stress on the heart, and changes in blood flow patterns can all contribute to stroke risk. Research has shown that heavy physical exertion can increase stroke risk in the hour immediately following the activity, particularly in people who don't exercise regularly. This doesn't mean exercise is bad, quite the opposite. Regular, moderate exercise is one of the best things you can do for stroke prevention. But sudden, intense exertion in unconditioned individuals creates acute stress on the cardiovascular system that can be dangerous. This is why it's so important to build up your fitness level gradually and to be aware of your limits. If you're planning to increase your activity level, do it progressively. Your body needs time to adapt to increased demands on your cardiovascular system. Our 8th hidden trigger is severe constipation and the straining that comes with it. This might seem trivial, but the research shows that straining during bowel movements can trigger stroke, particularly in older adults or people with existing cardiovascular risk factors. When you strain forcefully, you're performing what's called a Valsalva maneuver, holding your breath and bearing down. This maneuver causes a sudden spike in blood pressure and can affect blood flow to the brain. In people who already have narrowed arteries or other cardiovascular problems, this sudden pressure change can be enough to trigger a stroke. The same mechanism can occur with any activity that involves holding your breath and straining heavy lifting. Intense coughing fits, or even straining to reach something overhead. The key is being aware of when you're straining and finding ways to minimize it. For constipation, this means maintaining good hydration, eating plenty of fiber, and staying active. If you need to lift something heavy, remember to breathe steadily rather than holding your breath. Trigger number 9 is something that affects millions of people, particularly as they age: sudden changes in blood pressure medication. When people stop taking blood pressure medication abruptly, or when dosages are changed dramatically, it can create dangerous fluctuations in blood pressure that may trigger stroke. This is particularly dangerous with certain types of blood pressure medications called beta blockers and clonidine. Stopping these medications suddenly can cause what's called rebound hypertension. Your blood pressure shoots up even higher than it was before you started the medication. This rebound effect can be severe enough to trigger stroke or heart attack. Even switching from one blood pressure medication to another, if not done properly, can create dangerous fluctuations. This is why it's absolutely crucial to work with your healthcare provider when making any changes to blood pressure medications. Never stop taking these medications abruptly, even if you're experiencing side effects. There are safe ways to transition off medications or switch to different ones, but it needs to be done under medical supervision with proper monitoring. The research consistently shows that uncontrolled blood pressure is one of the most significant risk factors for stroke, but the acute changes in blood pressure that occur with medication changes can be immediate triggers. Our final hidden trigger number 10 is severe allergic reactions. During an anaphylactic reaction or severe allergic response, your body releases massive amounts of histamine and other inflammatory substances. This can cause dramatic drops in blood pressure, changes in heart rhythm, and alterations in blood clotting mechanisms. While most people think of allergic reactions in terms of breathing problems or skin reactions, the cardiovascular effects can be severe enough to trigger stroke. The sudden drop in blood pressure can reduce blood flow to the brain, while the inflammatory response can promote clot formation. Additionally, some of the medications used to treat severe allergic reactions, like epinephrine, can cause significant increases in blood pressure and heart rate. Food allergies, drug allergies, insect stings, and environmental allergens can all potentially trigger severe reactions. What makes this particularly concerning is that allergic reactions can develop at any point in life, even to substances you've been exposed to safely before. Adult-onset food allergies are becoming more common, and many people don't realize they have allergies until they have a severe reaction. Now that we've covered these 10 hidden triggers, let's talk about what you can do to protect yourself. The first and most important step is awareness. Simply knowing that these triggers exist puts you ahead of most people. You can now recognize potentially dangerous situations and take appropriate precautions. For infection prevention, practice good hygiene. Stay up to date with vaccinations and seek prompt treatment for any infections, even seemingly minor ones like UTIs. Don't let infections linger untreated. Pay attention to your body's signals and get medical care when something doesn't feel right. Hydration is one of the easiest protective measures you can implement immediately. The general recommendation is about 8 glasses of water per day, but your individual needs may be higher depending on your activity level. Medications and climate. Pay attention to your urine color. It should be pale yellow. If it's dark, you need more fluids. Remember that caffeine and alcohol can contribute to dehydration. For sleep issues, prioritize sleep hygiene and seek evaluation for sleep disorders. If you snore loudly, wake up gasping, or feel tired despite getting what should be adequate sleep, sleep apnea is highly treatable with CPAP therapy and other interventions. Stress management is crucial. Develop healthy coping mechanisms before you need them. This might include regular exercise, meditation, counseling, or other stress reduction techniques. During periods of high stress, be extra vigilant about other risk factors and consider seeking support. Weather awareness means dressing appropriately for conditions and avoiding sudden temperature changes when possible. When going from warm to cold environments, give your body time to adjust gradually. Be extra cautious during extreme weather events. Medication safety requires open communication with all your healthcare providers. Keep an updated list of all medications and supplements you take, including over-the-counter drugs. Never stop prescription medications abruptly without medical supervision. Be aware of potential interactions and side effects. Physical activity should be increased gradually. If you're sedentary, start with light activities and build up slowly. Even if you're fit, avoid sudden dramatic increases in intensity or duration. Listen to your body and respect your limits. For digestive health, maintain good hydration and fiber intake. Don't strain excessively. And address constipation promptly with dietary changes, increased water intake, or appropriate medications as recommended by your healthcare provider. If you have allergies, carry appropriate medications like epinephrine autoinjectors if prescribed. Wear medical alert identification and make sure family members know about your allergies and how to respond to reactions. The most important takeaway from all of this is that stroke prevention isn't just about managing the obvious risk factors like high blood pressure and diabetes, though those are absolutely crucial. It's about understanding that your body is an interconnected system where seemingly unrelated events can have serious cardiovascular consequences. Many of these hidden triggers become more dangerous when combined with existing risk factors or when multiple triggers occur together. For example, if you have high blood pressure and then develop a UTI while you're dehydrated, you've created a perfect storm of stroke risk factors. This is why it's so important to take a comprehensive approach to your health. Regular checkups with your healthcare provider, staying informed about your personal risk factors, and maintaining awareness of these hidden triggers can significantly reduce your stroke risk. Remember, knowledge is power when it comes to your health. The research from organizations like the CDC, American Heart Association, and Harvard Medical School gives us incredible insights into stroke prevention. But only if we put that knowledge to use. Every single one of these triggers is either preventable or manageable with the right approach. The next time you feel like skipping that glass of water, ignoring the UTI, or pushing through extreme stress without seeking support, remember what you've learned today. Your brain and your life may depend on it. Share this information with your family and friends, because stroke prevention is something that benefits everyone when we all understand the risks and how to manage them. The goal isn't to live in fear of these triggers, but to live with awareness and take reasonable precautions. By understanding these hidden risks and taking proactive steps to address them, you're taking control of your health in a way that could literally save your life. That's the power of knowledge, and that's why this information is so important to share.